Hi, sir. My name is Carly. I'm a nurse practitioner student at Oakland University. Today I'm going to be doing a neurological assessment on you. Is that okay with you?
Yep.
Okay. Now, to start off, throughout this exam, I'm going to just be observing your general appearance, like your mood, your affect, your eye contact with me. Um, Make sure that what you're saying is appropriate, that your logic and your memory is intact. Okay?
Okay.
So I'm going to start off with the cranial nerves. Cranial nerve 1 is olfactory, and that's just testing your sense of smell. So what I would do for this is I would have a vial of something that smelled like either coffee or lavender and have a few different things. I would have you occlude one side of your nostril and see if you could smell what I was holding, and then do the same thing for the other side. Cranial nerve 2 is the optic nerve. For that one, I would use the ophthalmoscope and I would look in each eye and see if I could visualize your optic nerve and optic disc. Cranial nerve 3, 4, and 6. 3 is oculomotor, 4 is trochlear, and 6 is the abducens. So for that, I would do the H test. So I'd have you look straight at me and just moving with your eyes, follow my pen. Okay, so going lateral would be the abducens, going up and down on both sides would be oculomotor, and going medial and down would be the trochlear nerve. Okay, and next, cranial nerve 3 is the motor portion. Can you raise your eyelids for me? Okay, very good. Cranial nerve 5 is trigeminal. For this, I will touch your forehead and tell me if you can feel on both sides.
Mm-hmm.
Okay, and same on your cheeks.
Yep.
And on your mouth.
Yep.
Okay. And now I'm going to have you bite down as if you were chewing and clench your teeth. Okay, good. Now moving on to cranial nerve 7, which is facial. For this, I would observe your eyebrows. Raise your eyebrows. Good. Can you smile now? Okay, and puff out your cheeks. Good. Moving on to cranial nerve 8, which is the acoustic nerve. For that one, I would do the whisper test. So I'd have you include one of your ears, and I'm going to whisper a word, and you tell me if you can, what I was saying.
Apple.
Okay, and same thing on the other side.
Orange.
Okay, very good. Cranial nerve 9 is glossopharyngeal, and cranial nerve 10 is vagus. So for this one, can you open your mouth, and I would have my pen light and say ah.
Ah.
And I would observe the rise and fall of your uvula, which is normal. And also I would observe you swallowing. Okay, very good. Cranial nerve 11 is accessory. For this one, I would have you rotate your head and push against my hand. Okay, good. And same here. Good. And can you shrug your shoulders up and don't let me push down? Okay, very good. And number 12 is hypoglossal. This would be tongue protrusion and strength. So can you stick out your tongue at me? Good. And now close your mouth and push your tongue against my fingers, and on the other side. Okay, good. So that's all the cranial nerves. Now I'm going to move on to the muscles. So first I would just be observing the size and the contour of your muscles, and looking for any involuntary muscle movements, which I don't see any. Then I would test the strength of your upper extremities and then your lower extremities. So for the upper extremities, can you push your arm out towards my hand? Okay, now pull in. Good. And now put your arm up like this and pull, push. Good. Now same on this side. Push out, pull in, good, and pull up, and push down. Good. Okay, and now the lower extremities. I would have you push up against my hand. Good. And push up against my hand again. Good. And on your shin, push against my hand. Other side. Okay, and now it's behind and pull down. Good. And pull down. Good. And then for the hips, you're fine there, testing adduction. So push in against my hand and in against my hand, and abduction, pushing out and out. Okay, very good. Also, I'd be looking for any muscle atrophy during this, which I don't see any. All your muscles look normal. Now moving on to balance and gait. So for this, I would normally just be observing you as you walk into the exam room, make sure that you have steady gait and that your balance is good. But for this test, I'll have you stand up and just take a few steps towards me on your heels. Okay, good. And go ahead and turn around and walk the other way, but this time on your tiptoes. Okay, good. And now walk towards me, but do heel to toe like you're walking a straight line. Okay, perfect. Looks like your balance is intact. Now standing up still, I'm going to test for pronator drift. So just put your arms out with your palms up and close your eyes. Okay, and then for that I would just note if one of your arms were to drift off, but they look okay. And same thing, just go ahead and close your eyes, and I'm going to kind of push you just a little and make sure you can keep your balance. Okay, good. So that's the Romberg's test. So that is normal as well for you. Moving on to ataxia. So for this one, I'll have you touch your nose, and then with your finger touch your nose, and then touch my finger. And same thing here. Okay, good job. Okay, now next is rapid alternating movements. So I'll have you, as quickly as you can, do this. Good. Okay, and now the next test is called heel to shin. This is also looking for involuntary movements. So go ahead and place your heel up like this, like up, yep, and now run it down your shin. Okay, that's good. And do it again. Okay, I don't see any jerky movements there. Okay, moving on to the sensory functions. For most of these tests, I'm going to be having you close your eyes, okay? Okay, so first I'm going to have you close your eyes, and I'm going to touch you, and you let me know when you can feel me, okay?
Okay.
Go ahead.
Mm-hmm. Yep. 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 Mm-hmm. Yep. Yep.
Okay, good. So I did your lower arms, your hands, abdomen, lower legs, and your feet. Okay, next I'm going to be testing motion and position sense. So I'm going to have you, I'm going to hold on to your finger, just one, and let me know when you close your eyes, let me know if I'm moving your finger up or down.
Okay. Down. Down. Up. Up. Down.
Okay, good. Then moving on to vibratory sense. For this, I would have a tuning fork. I would strike it, and I would place it at different points on your body with your eyes closed, and you would tell me when you can feel the vibration. And that's it for that one. Next test is called stereognosis. I would have you close your eyes again, and I would have you stick out one of your hands and place an object and tell me what it is.
Rubber band.
Good. Okay, and now same thing, but put your other hand out and place a different object.
Battery.
Mm-hmm. Good. Next is called 2-point discrimination. So I would do this on both sides, but for this test, I'm just going to do it on your left arm.
Okay.
So I'm going to touch you in 2 places and get closer together, and you let me know when it feels like just one thing is touching you, okay?
Sure. 2. 2. 2. 2. 1.
Okay, good. I would do the same thing on the other side. Then extinction. For this test, I would again have you close your eyes and tell me if I'm touching your right side, your left side, or both sides, okay?
Okay. Both. Right. Left. Right.
Good. Okay, now moving on to your deep tendon reflexes. So again, I would do both sides, one then the other, and then move on to the next reflex. But for this test, I'm just going to be doing your left side of your body.
Okay.
So first is your biceps. So just rest here and relax it. Okay, I'm looking for your arm to flicker. Good. And next one is called brachioradialis. Looking for your thumb to twitch. Okay, good. Triceps. For this one, I'm going to hold your arm in support and just let it relax. Good. See a little flicker of your fingers there. Next one is your patellar reflex. So for this one, make sure that your knees are not touching the exam table and that your legs are just dangling freely. Okay, I'm just going to adjust the camera. Okay, for this one, I'm looking for your leg to go out. Okay, good. And last reflex is the Achilles. So for this one, I'll have you stand up and go like this so your heel is off the edge. Okay, good. And I would strike right on the Achilles tendon. Oh, good. Good reflex. Okay. Alright, so those are all the reflexes. And the last thing I'm going to be doing is testing for nuchal rigidity or meningeal irritation. So for that one, the first thing I'm going to be doing is Kernig's test. So I'm actually going to have you lay down on the bench on your back. Okay, so for Kernig's, I'm going to raise your knee up at a 90-degree angle, and then I'm going to straighten your leg, and you tell me if this creates a lot of back pain for you.
Nope.
Okay, good. And put this one down. And do the same thing on the other side. Any excessive pain there?
Nope.
Okay, good. And when you're looking for meningeal irritation, positive finding would be a lot of pain on both sides when you do that to your legs. And the last test for nuchal rigidity, suggestive of meningitis, would be Brudzinski's sign. This one, you would have your legs straight out. Okay. and I would gently raise your neck. And if you had a lot of back pain from that, or also if your feet and your knees involuntarily raise up off the table, that could be a sign of meningitis as well. Okay, thank you, that's it.